Hi, everybody. I'm super excited to introduce you to Dr. Liz Joy, the board chair at Ucare. Ucare is a nonprofit organization here in Utah dedicated to improving air quality. Dr. Joy is a family medicine and sports medicine physician at Intermountain, and she's interested in outdoor physical activity. So since moving here from Minnesota and seeing kind of the struggles we sometimes have with air quality, the inversions, the haze, the smog, she's been dedicated to improving air quality here in Utah ever since, and we're super grateful for all of her hard work and dedication. And I'm super excited to share with you our interview that we had about air quality and what we can do to improve it. So I hope you enjoy. Alrighty, it says it's going. Perfect. So I am with Dr. Liz Joy, who's the board chair of Ucare, a nonprofit organization here in Utah, who helps and partners with organizations to help improve air quality. I'm super excited to talk with you more and to ask you some of the questions that I have about how air quality affects health and what we can do to improve air quality and just sort of things like that. I'm super excited.
Sounds good. Look forward to it.
Awesome. So just to kind of start out with, how long have you been working with Ucare?
I've probably been with Ucare for about 5 or 6 years. I came on as a board member and then was asked to be the chair-elect and then the chair. So this is the year I am chair of the board. It's a great board, great organization. I like to think of Ucare as a really big tent. And that tent really is inviting lots of people, in the Utah community to partner with one another, to brainstorm ideas and to act, around how do we improve Utah's air so that we, can enjoy this incredible place that we live.
Absolutely. I mean, it's so gorgeous and you want to be outside and be in it.
Absolutely.
Awesome. So the second question, what made you want to be a more active participant in improving Utah's air quality? In sports medicine, so.
Well, I moved to Utah from Minnesota. And, if Minnesota ever had bad air, the wind came and just blew it to Wisconsin. I never really gave air quality a thought until I moved here, and I spent my first winter here. And driving down from Little Cottonwood Canyon one day, I had to ask my husband, what the heck is that? And it was just this layer of, smog, in the valley, to which he said, oh, well, that's an inversion. And that's really when I started to get involved in air quality. And when I moved my practice to Intermountain Healthcare about 10 years ago, I asked our chief medical officer, what is Intermountain doing about air quality? And he said, well, I don't really know that we're doing anything about air quality. And so, as often is the case, the squeaky wheel gets the job. And so it was at that time that I partnered with our director of sustainability at that time, Steve Bergstrom, to develop Intermountain's first development team around air quality and health. And we invited a broad group of physicians and scientists to come together to really try and address how air quality would affect health, and how do we educate our physicians, in terms of how they're caring for patients, and how do we educate our patients and the broader community about air quality and various health issues. And so, that was a lot of our work, and we've since expanded into doing more research. And it's been a really fruitful effort, I think, for our organization, and it really led to my kind of more community work with Ucare.
Absolutely. Thank you for all of your work that has been done. I know we have so many inversions and it gets super crazy sometimes. So thank you for your work on that to help improve Utah air quality, because heaven knows we need it, right?
Absolutely.
Awesome. So what are some of the things that Ucare has done? Like who have they partnered with? What kind of promotions or challenges have they done to help improve Utah's air quality?
Well, I mean, Ucare is the Utah Clean Air Partnership. And there are a multitude of organizations, some representing people who do active transportation, and bicycling, like Green Bikes, partnering with, obviously, the Wasatch Front Regional Council, that looks at transportation. We work very closely with the Department of Environmental Quality and the Division of Air Quality, with the state.
Nice.
We partner very closely with the governor's office, with the University of Utah, with Intermountain Healthcare,
Yeah.
with law firms, with even our, energy companies like Rio Tinto, like
Mhm.
Marathon, among others, auto dealers, and that's what I really mean by a big tent.
Yeah.
Everyone knows that Utah has some challenges when it comes to air quality because of our
Mhm.
topography,
Yeah.
with mountain ranges on east and west sides of the valley,
Yeah.
and with our population density being along the Wasatch Front between Ogden and Provo.
Mhm.
When you have 80% of your population that lives in a bowl, that's really why we
It
see,
collects.
right, that's why we see more pollution. And it's actually the topography that creates the temperature inversions. And
Mhm.
when you have that lid of warm air, it traps all of the pollution in our kind of breathing atmosphere, and that's why it looks so smoggy. And that's a lot of our particulate pollution, and about 50 to 60% of that comes from our tailpipes.
Yeah.
So a lot of the work that UCAIR does, with its partners, is to try and reduce tailpipe emissions.
Interesting.
And so, that includes, improving our transportation infrastructure,
Mhm.
so that we have better public transportation and we promote safe, active transportation. It's working with the fuel companies, to try and bring in more tier 3 fuel, that has lower pollutants. It's working with the auto dealers, right, to ensure that we have, automobiles that have all the pollution safety controls. So that's why those partners, are so important in terms of coming together and in their lane,
Mhm.
coming up with solutions, that in total, can improve our air.
Yeah. Oh, that's awesome. It seems like you just have this huge, like, wide reach because it really is just everybody involved. It's not just one thing that changes air quality, it's everybody involved. And that's when air quality can change and when you can actually do something. Um,
Absolutely. I
wow.
mean, we need policy, right? So
Yeah.
it's also, you care. I mean, we're not lobbyists,
Yeah.
but we certainly are a source of truth and do a lot of education with our policymakers.
Yeah.
We work very closely with the Utah Clean Air Caucus, with the legislature. And so policy is really important, and working closely with other, government organizations, as I mentioned, DEQ and DAQ,
Mhm.
to ensure that we're communicating effectively,
Mhm.
about those policies that are being developed. Um, all of those things, make a difference. And to your point, everybody has a role. And I think that's an important point to make, right? So it's, what do we do as individuals,
Yeah.
right, that are going to result in cleaner air? Maybe when we replace our next automobile, we go for hybrid or electric.
Yeah.
When we are mowing our lawns or snow blowing our driveways, that we're choosing, clean energy alternatives. Maybe we're
Yeah.
using, electric instead of gas powered.
Yeah.
That when it's possible to, chain trip and do multiple errands at one time, so you're not doing cold starts, which increase, tailpipe emissions. That, when you replace your water heater at home, you put in a low NOx water heater. When, you can walk someplace or ride a bike someplace, rather than drive, you make that choice. So I think everybody's collective efforts are what are going to really move the needle when it comes to improving air quality here in Utah.
Absolutely. I love that. And it kind of answers one of my questions is just, like, what can we do to cut down emissions? Like, we hear that phrase so often and people think, oh, emissions, like it has to be this huge big thing. Like when I cut down my emissions, it has to be a big deal. Like I have to make this huge life change. But like what you were talking about, just like daily planning and trying to get those errands done all at once, that can be a chance to cut down on our emissions, maybe using our car so often. And my husband and I, we were having fun last night. We were on UCAIR's website. We were looking at the smog calculator and we were looking
Oh, yes.
cars, and it was so much fun. We're like, oh, I wonder if like we were looking at like Teslas versus like trucks and like the difference between like their smog ratings, and just very interesting to see like the decisions that we make have a big role and they can really improve air quality. So thank you for that. Just really, so we see the air quality index like on our weather apps, like on our you can look it up online. What does that like really mean? What does a good air quality look like, and why the numbers, kind of a thing?
Yeah, that's a good question. So I think the AQI is a really easy way, you know, because it's just a single number. It doesn't even have any because it's a composite, it's an index.
Yeah.
You know, it's not too sciencey,
Mhm.
right? It doesn't have milligrams per deciliter or some other, you know, which I think, you know, can make it when people are confused and they don't really understand what something means, they don't act.
Exactly.
So I'm a big proponent of the AQI. It's a composite of measuring different types of pollutants in the air. So particulate pollution, nitric oxides, sulfur oxides, carbon monoxide. So lots of different components make up the AQI, ozone. And it is color coded. So green is good.
Yep.
You know, AQI is 50 or less, you know, we consider air quality good. And let's see, I don't know that I've looked at the AQI yet this morning because I haven't been outside, but if I look at my air quality app, right now it says that the AQI at Hawthorne Elementary, which is closer to where I live, is 27. So it's good. And we can also look at, you know, a forecast. And, you know, the forecast is that, you know, air quality will be, you know, good in the coming days. So, you know, weather does make a difference, so that when we're having snowstorms in the winter, rain in the summer, you know, that tends to clear our air. So we're always happy to have a good snowstorm. You know, and then the colors move on from there. And likewise with, you know, how we define them. So for example, we move from green to yellow, which would be air quality between, or an air quality index between 50 and 100, which is, you know, unhealthy for sensitive individuals. And then it moves from 100 to 150. That's when we move into the orange zone. And then, you know, from there into the red zone, into a purple zone. So, you know, the darker the color gets, the worse the air quality is.
Don't want to deal with
And
it.
and particularly for people who have underlying health conditions like asthma or heart disease, women who are pregnant, infants and children, you know, as the colors get darker, they should really avoid outdoor activity, you know, in an effort to try and reduce their exposure to air pollution.
Awesome. So just staying inside is probably the best thing to do when it is those bad air days, when we have that poor air quality, kind of staying inside, but also like avoiding travel, maybe being inside.
Absolutely. You know, it's both, you know, health and action.
Yeah.
Right. And so we want people to make good choices for their health in the wintertime. You know, it may also mean if you want to do outdoor exercise, do it early in the morning. You know, for air pollution tends to build over the course of the day as people are driving. You know, since 50 to 60% of our particulate pollution, you know, really comes from tailpipes. So, you know, if you want to do outdoor exercise at, you know, 6 in the morning, you know, that's better than doing it at 8 in the morning, you know, in the middle of the commute. And likewise, you want to avoid outdoor exercise at, you know, between 4:30 and 6:30 at night when we have the commute at the end of the day. Alternatively, if you want to do outdoor activity in the wintertime, you know, you can go to a higher altitude and be active, you know, above the inversion. You know, I've had many a day where I'm driving through kind of the cloud, you know, up Little Cottonwood Canyon to go skiing. And all of a sudden at Snowbird, you emerge, you know, out of this cloud into a bright, sunny, beautiful day.
Looks so much better.
That's right. So getting above the inversion is another safe way to do outdoor activity.
That's good to know. I have a lot of family who are really into trail running and being out in the mountains, and so that's good to know that like earlier you go, that's something I didn't know. The earlier you go, it's probably better for your health. So
Yes, absolutely. And the same thing is true. I mean, we talk a lot about winter pollution,
yeah,
because you can see it.
yeah.
One of the other air quality challenges we have here in Utah is ozone, and ground level ozone is created by a chemical reaction between, again, some of the tailpipe emissions and sunlight. And together, they have a chemical reaction that creates ground level ozone. And ozone is colorless, it's odorless. People just don't notice it as much. And so they don't think of it as a big problem. But, when you have a lot of concrete, which again, because we have such population density between Ogden and Provo, we have more concrete, it's lovely and sunny here. And so that combination between concrete and tailpipe emissions and sunlight create ground level ozone, which is also not so good for your health. It's been found to actually cause asthma, not just exacerbate asthma, but cause asthma, particularly in children. And ozone, is considered very inflammatory. So sometimes, the effect that people have is they may feel like their throat is a little sore or their eyes are burning. It's a little different than, what we experience with particulate pollution when, it's there because you can see it, smell it, and taste it.
Yeah, it's just kind of nasty to
Yeah.
oh, yeah. So, quick question, just like based on like the ozone, like that kind of pollution or like the particulate matter pollution, do we see those certain types of pollutions more or less during the year? Like during the summer months, do we see like particulate matter, and during the summer, do we see more of like the ozone? Because I know sometimes summer can also have that poor air quality. I mean, we have a lot of fires here as well. So does that play a part into it?
Absolutely. I mean, our summer air pollution is, ground level ozone and wildfires.
Okay.
And, unfortunately, the wildfires in, California, other parts of the Western United States, and here in Utah, have contributed to incredibly bad air. In fact, we've had, I believe the Spanish Fork fire a couple of summers ago, resulted in Utah having the worst air in the world, on a couple of days.
Is that bad? Wow.
I mean, when we think about, some of the places in the world where air quality is particularly poor, like in China, for instance, because of all of their coal-fired power plants.
Absolutely.
But yes, there was a day last summer and a couple of days, the summer of the Spanish Fork fire, which was, I think, a few years back, where Utah had the worst air in the world.
Wow.
So, and of course, the increase in forest fires, is part of our climate change problem and, global warming. And so, yes, increasingly we will see wildfires, as a part of our air pollution problem.
Interesting. Perfect. Well, thank you so much. One final question I have is, so as part of this, we talk a lot about prevention, we talk a lot about education. What are some of the best ways that we can educate ourselves on air quality, what we can do? I've spent a lot of time this week on Ucare's website, just kind of playing around, looking at some of the information that you guys have. So Ucare website is obviously definitely a good place to be educated. Are there other places where we can educate ourselves or learn more about air quality to help us improve Utah air quality?
Well, again, I think UCAIR's website is great. It's great for parents, for adults, and for kids. There's some really cute videos there. I would definitely encourage people to go there. There's great information, on the Division of Air Quality website for the state. Even looking at what the Centers for Disease Control has. About air quality and health, can be really informative. And that is the whole point here, right? Is that, information is power. And having that information, can help you decide what you're going to do, to protect your health, protect the health of your loved ones, and to protect the environment in which you live.
Absolutely.
And I think that, the air quality apps are important. And I really do encourage my patients, to download either UCAIR or airnow.gov. I have both of them on my phone, so that you can be informed and you can see what the air quality index is and use that to guide your choices around physical activity, around transportation. An informed person, is someone who is going to act to protect, like I said, protect their health, the health of their loved ones, and to protect the environment. That's really what it comes down to.
Absolutely. Thank you so much for answering my questions, for this awesome conversation. I feel like I learned a lot more about what I can do to be a more conscious, air quality improver, and I can do what I can to help the community, and I hope those that watch this video also learn something new and that they take what they learned and are able to make those, like what you said, those conscious decisions to be somebody who can improve the air quality by those simple things. So thank you so much, Dr. Joy.
My pleasure.
I'm so happy that you've been able to be with us today. Thank you so much.
Well, thank you.